Namaskar. I am Dr. Chinmay Raj, working as Assistant Professor in the Department of Dermatology, KIMS Hospital. Today I will be speaking on hair fall or hair loss as it is commonly known. So I would like to first give a basic outline of the structure of hair. Hair is an appendage of skin, and as you can see, half of the hair is present under the skin, the other half above the skin. So it is also a defining characteristic of the mammals. They are found everywhere on skin except palms, soles, glans penis and vaginal introitus. To understand hair follicle, first we have to understand hair cycle. So we have to know it है main जिनसो या बारे में. This the thing, the disturbance, the irregularity in the hair cycle causes different types of hair loss. So the hair follicles undergo repetitive sequence of growth and rest known as the hair cycle. So anagen is the growth phase which lasts for a duration of 2 to 7 years and consists of 80 to 90% of the hair present on the skull. Catagen is a transition phase which rests between anagen and telogen. The duration is 2 to 3 weeks and consists of 1% of the hair. The telogen phase or the resting phase lasts for 3 months and comprises of 8 to 9% of the hair. The irregularity here causes different types of hair loss. This you have to remember. So coming to the functions of hair, so this is just a basic. It helps in thermoregulation, camouflage, physical barrier, regeneration and repair, secondary sexual characters, insulation against heat loss, overheating, and desiccation. So these are a few systemic causes of hair loss, such as polycystic ovarian syndrome, hyperandrogenism, thyroid dysfunction, virilizing tumors, iron deficiency anemia, caloric restriction, SLE or dermatomyositis, which are autoimmune disorders, infections which may be viral or bacterial, and stress, physical or emotional. So we have a lot of hair disorders here where hair loss may occur, but the most common presentations in our OPD, we see these three different types of hair loss. One is the male pattern baldness or the female pattern baldness, which is a genetic which has a genetic predisposition, occurs due to genetics, and it may be passed on both by both of the families, from the mother's side or the father's side. Then telogen effluvium, which is caused by stress, and then we have alopecia areata, which is an autoimmune disease, and it is set off by illness or stress, and alopecia totalis, which is a very severe version of alopecia areata. So we'll first discuss a little bit about alopecia areata. It is a common chronic inflammatory disease directed against the anagen hair follicle, causing non-scarring alopecia of the scalp, beard, and/or body hair. As you can see in the picture on the right side, there is patchy hair loss which may occur suddenly. It can occur in both males and females, and also in any part of the hair bearing area of the body, such as this is an example of beard area alopecia areata. Then coming to the androgenetic alopecia, it is the most common cause of hair loss affecting nearly 50% of the population. It is characterized by gradual loss of terminal hairs in a pattern distribution. The pattern is such: the first grade usually affects the temporal areas like this, then going progressively they go deeper into the frontal, mid-frontal and the vertex area, and lastly the highest grade where there is complete baldness of the frontal, mid-frontal and vertex area of the scalp, which is called baldness. It can also occur in females. Very often you will see signs of thinning when your hair is wet or oil application is there, or when you stand directly under the light. So these are the three types of female hair loss or genetic hair loss, where there is thinning in type 1 and complete baldness in type 3. The cardinal features are: balding pattern starts with miniaturization of hairs. There is gradual onset with progression. There is usually occurs after puberty. There is family history of baldness, like on mother's side or on father's side, even on their maternal, paternal uncles or grandparents. Then there is thinning with or without gradually developing bald patches. This is a picture showing both female and male pattern hair loss. Coming to the third type of hair loss, this is telogen effluvium. It's a diffuse, non-scarring and reversible type of alopecia due to abnormality of hair cycle, occurring as a reaction pattern to various physical and mental or psychological stressors. Acute telogen effluvium is one that occurs within 3 months of the inciting event, and chronic telogen effluvium which persists for more than 6 months. So the patient experiences diffuse hair loss. The causes may be postpartum or post-delivery pregnancy effluvium, physiologic effluvium of newborn, where the hair that the newborn was born with is shed gradually before getting permanent hair. Then physical or emotional stress such as severe fevers, severe infection, starvation, malnutrition, marasmus and kwashiorkor, malabsorption, iron deficiency anemia, hyperthyroidism, chronic severe psychological stress. Drugs such as oral retinoids, high dose contraceptives, or hormone replacement therapy, prostaglandins and beta blockers. The clinical features are the patient may experience loss of hair with varying severity, excessive hair fall during washing or combing, hair shedding during running fingers through hairs, and bitemporal thinning of hair may be visible in patients who have lost more than 40% of the hair volume. So these are the most common diseases that we see in our OPD. So few points to remember are losing 50 to 100 hairs per day is normal. There is no need for alarm for the same. There are 100,000 hairs on the scalp and ପାଖାପାଖି ଲକ୍ଷେ ହେୟାର ଥାଏ ମାନେ at a given any given point, and ସେଟା ସବୁବେଳେ ଗୋଟେ constant renewal process ରେ ଥାଏ. Suppose ଆପଣ ଦେଖନ୍ତୁ ଯଦି 50 to 100 per day hair ଝଡୁଛି, then 100 per day hair ଉଠୁଛି ବି. that gap is will only notice ଯେତେବେଳେ ମୁଁ ଫର୍ଷ୍ଟ ସ୍ଲାଇଡ୍ ଯେମିତି କହିଲି କି ଅଧା ହେୟାର ସ୍କିନ୍ ତଳେ ଅଧା ହେୟାର ସ୍କିନ୍ ଉପରେ ଥାଏ, ତ ସେ ତଳେ ଯୋଉଟା ଥାଏ ସେ ଗ୍ରୋ ହେଇକି ଆସିଲେ ବାହାରକୁ ଜଣା ପଡ଼ିବ. So there is no need to be alarmed, no କିଛି ଡରିବା ଦରକାର ନାହିଁ, ଚୁଟି ପୁରା ଯିବନି. And if you are then ଅଧିକା 100 ରୁ ଅଧିକା ଯଦି ହେଲା, then you come to consult a dermatologist for a tailor-made solution. So few tips for healthy hair. Oily hair बेसी धोइबा कथा, शैम्पू बहुत फ्रिक्वेंटली करे कथा, तेल लगे ओवरनाइट छाड़ा कि डेज टुगेदर. एंड आई हैव सीन पेशेंट्स जे आसी कहते आम सप्ताह थरे कि मसरे 2 थर धोचु. दैट इज नॉट डन. जिते मली जमा हम सेते सी जगार मुंड कुंडे हम कि डैंड्रफ हवा चांस अच्छी, जहाँ जो कि आम हाथ मारिकी नख मारिकी कुंडे दबा, कुंडे देले पुणी से मेकानिकली डैमेज होगी हेयर झड़ीज. सो दैट इज वन कज. जिते सफा रते हेयर लॉस भी कम हम. तो जदि भी तेल लगे अच्छी यूजुअली स्काल्प को अवॉइड करेंगे. तेल को माने हेयर लगे पारे बट स्काल्प रे लगातुनि. देन शैम्पू जदि करेंगे स्काल्प को शैम्पू करेंगे. कंडीशनर जदि लगे चुटीर टिप्स रे लगे कथा. देन स्विमिंग हेका जदि किछि करूछंती कि बाइक राइडिंग करछंती कि कोन, ऑलवेज हेयर प्रोटेक्शन न पड़िबो. सो आज है वर्ल्ड स्किन हेल्थ डे 6 एप्रिल. तो आम थीम है ऑल स्किन कलर्स आर ब्यूटीफुल, एंड दिस इज फॉर अवेयरनेस ऑफ माय स्किन हेयर नेल एंड जेनिटल प्रॉब्लम रहिला ताले गोटे आइडियल स्किन स्पेशलिस्ट को देखा करंतु, कंसल्ट करंतु. So consult a dermatologist near you for specific solution to your hair fall or any other skin related issues, and avoid so called treatments recommended by आपनको chemists and friends. से माने बहुत किछि कहि देबे बट तार किछि बेसिस न था. इट कॉजेस मोर हार्म देन एनी गुड. किछि बेनिफिट एते करेनी. थैंक यू. सो इफ माय व्यूअर्स यदि कि चाहउछन किछि क्वेश्चन पचारे को, प्लीज यू कैन बिगिन. So the first question is hormonal changes. Do hormonal changes affect hair fall? Yes, they do. So for that we need a combined approach of dermatologist and a endocrinologist. We have to work up. We have to see कौन hormonal changes ହେଇଛି. से हिसाब रे तारो ट्रीटमेंट करिया को पड़िबो both ways. Role of diet and nutrition. So we need a for anything, even for healthy skin, for hair, we need a balanced diet. Too much of anything is not good. And of course, high glycemic index, बेसी मीठा जिनस खाया कथा नहीं, बेसी शुगरी, जैसे इवन नाउ सीजन आसीगला मैंगो एंड ऑल, सब मॉडरेशन में खाया कथा. एंड ए गुड क्वांटिटी ऑफ प्रॉपर प्रोटीन भी दरकार फॉर गुड हेयर ग्रोथ. So different out question अच्छे कि किसी proper hair vitamins. Okay, तो different types of hair fall अच्छे. इसरा hair fall हमें एमती गोटे ब्लैंकेट दी परिवाने कि हाँ जितना hair fall अच्छे सब जगह हमें इटा दे दले से ठीक ही जीवो. से एमती हुए नहीं. तो different conditions में different treatment अच्छे. How does stress impact hair fall? Okay, तो stress impacts hair fall a lot. मु मोर previous slide एटा कही चिबे. So it may be emotional, it may be physical. बहुत लोग को पचारती कि आमे अलग जगह आसचु, वी हैव कम फ्रॉम, हम कहीं और से आए हैं, वी हैव कम टू भुवनेश्वर, नाउ वी आर गेटिंग मोर हेयर फॉल. सो sorry, so the thing is, hair fall that can be a cause. You're traveling or you coming and staying in a new place, एक नए जगह पर आके रहना may be a stress factor for you. You are adjusting to the new environment. I'll give you a simple argument. Suppose a person has come from Maharashtra and here he is experiencing hair fall, but do the people here जो आज यहाँ पर है, suppose भुवनेश्वर के people, are they experiencing hair fall? All of them. That should hold true for them as well, right? So someone like यहाँ से महाराष्ट्र जाएगा, he will say the same thing. अभी महाराष्ट्र में, so you cannot say that everyone is experiencing a hair fall. So सबका reason रहता है, सबका एक cause रहता है. So that has to be taken care of. Shedding and problematic hair fall. Okay, as I said, more than 100, or if agar aap if you experience sudden hair loss, sudden, like as in alopecia, right, you will experience sudden dermatologist. हेयर पतला हेबार प्रारंभिक लक्षण गुड़िक कौन? तो हेयर पतला हेबार फर्स्ट तो मु कहबी एजिंग. सो आमे 20 वर्ष आम 20 वर्ष से चुटी रही. एंड अगेन जेनेटिक्स प्लेज ए रोल. समस्तंकर जेतिक रहा कथा सेतिक ही रहिबो अल्टीमेटली. आउ एमती नहीं कि आमे जहाँ 15 इयर्स 20 इयर्स जी चुटी रखते सेटा सेतळे परे भी रहिबो. दैट इज नॉट पॉसिबल. सिमिलर जंते आपण एजिंग स्टॉप कर परिबेनी, थिनिंग गोटे सर्टेन एज रे जमी हेयर थिनिंग हुए, आम स्किन भी थिनिंग हुए. तो आपड़ देखिए गोटे 30-year-old पर्सन स्किन आउ गोटे 60-year-old पर्सन स्किन में बहुत डिफरेंस थाए. तो सिमिलरली हेयर भी सिमिलर चेंजेस हुए. Is visiting a parlor for hair treatment advisable? So we cannot advise that. से माने कौन करछन हमें जानिनु. एंड रिसेंटली रिपोर्ट्स आसीछि कि हेयर स्ट्रेटनिंग एंड से जो आयरनिंग हेका करछन्ती ता जोगु किडनी इंजरी होछि. You can look it up on the net. आम न्यूज रे आछि एगुडा सब. So I cannot say if it is advisable. That is completely on the patient. आपण जदि solution दरकार, you should visit someone like a dermatologist who can give you a solution. घरोई उपचार केते भल, आई हैव टू नो, जाने अच्छे कि कौन आप कहते. सो से हिसाब से मुझे कहीपरि. एंड आइडियली जी मुझे जानी लोक मैंने हेयर फॉल है तो कौन लेंबू घसती एंड आई थिंक रसुण घसती. दैट इज नॉट ये क्या दैट मे इटसेल्फ कॉज एलर्जिक रिएक्शन से टू हेयर कहीपरि इफ दैट वाज योर डाउट. तो can hair fall? Yes, if you avoid it in the future. Can hair fall caused by styling damage? It can be doing it in the future. I've already answered this question too. Can hair fall be a symptom of an underlying medical condition? Yes. So in my previous slides, I have. Can I show the slide? So these are some of the factors. Along with that, the diet is also here. जैसे caloric restriction लिखा है सेटा गोटे important जिनस. Along with that, even smoking plays a role. So that has to be taken care of. Are there any hair care practices or products that should be avoided to prevent hair fall? तो आई थिंक बाहर पार्लर हेकर जो आयरनिंग एंड जस्ट ना कहली से कथा से सब जिनस टिके स्ट्रेटनिंग हेका कले दैट हैज हार्मफुल केमिकल्स that can affect your hair quantity as well as it may cause kidney injury, so better to avoid. Next. 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 Okay, so I think ଆପଣଙ୍କ questions and most of the ଜିନିଷ ମୁଁ ମୋର presentation ରେ cover କରିଦେଇଛି, so thank you very much.